Okay, so good evening, Tewksbury. It is 6:01 p.m. on Thursday, June 18th, 2020. I'd like to call this meeting of the Tewksbury Board of Health to order. Yet again, due to COVID-19, it's another virtual online meeting that will be uploaded to YouTube tomorrow. On our agenda tonight, it's a short agenda, but it's an important one. Before we go any further on the agenda, the first item of business is, since we just had our annual town election on Tuesday, is the annual reorganization of the board.
You gonna do a roll call, Frank?
Yeah, we'll do a roll call vote first. So it's Chair Ray Barry, Vice Chair.
Toronto, present.
Okay. Clerk.
Maria Zaroulis, present.
Member.
Charlie Rue is here.
Okay. It looks like that's it for what we have. So members have talked betwixt one another's one-on-one, and I guess, Charlie, if you want to pick this up.
Yes, I'd like to make a motion that we keep the current configuration intact regarding yourself, Bob Scarano as Vice Chairman and Maria Zaroulis as Clerk. I think we have to vote on it independently, but I'm pretty comfortable with the way things are going.
Okay. Well, thank you for that vote of confidence for all three of us. And you are right. We will need to take these individually with the role of the chair going first. So I'm going to have to recuse myself from this because I can't vote for my position. So I'll need one of the other members to put forth a motion and the other to second. I can at least run that part.
I will make a motion that Ray Barry remains our current chairman of the board.
Okay. And
I
who'd
would
like to
second the nomination and motion.
Okay. So motion's been put forth and seconded to have Ray Barry remain as chair of the Board of Health. All those in favor signify by saying aye. We'll take a roll call. So Maria Zaroulis.
Aye.
Okay. Mr. Scarano.
Aye.
Mr. Rue.
Aye.
And chair is not able to vote in this, so the motion carries unanimously 3-0. Okay. Well, thank you. Thank you for your vote of confidence. So next we have to take care of the vice chair. So if either Maria or Charlie, if one of you'd like to make a motion to re-elect Bob Scarano as vice chair.
I'll make a motion to re-elect Bob Scarano as vice chair of the Board of Health.
Okay. Charlie, would like to second that?
Yeah, I'll second that.
Okay. So motion's been put forth and second to re-elect Bob Scarano as vice chair of the Board of Health. Again, all those in favor signify by saying aye. We'll take a roll call. So Maria Zaroulis
Aye.
and Mr. Rue.
Aye.
And chair votes aye as well. So the motion carries unanimously 3-0. So Bob, welcome back as vice chair.
Well, thank
And-
you, and thank the members and you, Mr. Chairman.
And the
And
last,
thank you, Mr. Ruler.
You're welcome.
and that's a good segue into our final and last board position, role of clerk. If either Bob, you or Charlie would like to nominate Maria to be the re-elected as the clerk.
I will nominate and motion that Maria be appointed the clerk of the Board of Health.
Okay. Charlie, you going to second that?
I'll second that.
Okay. Motion's been put forth and seconded to re-elect Maria Zaroulis as clerk of the Tewksbury Board of Health. All those in favor signify by stating aye. We'll do a roll call vote. Mr. Scarano,
Aye.
Mr. Rue,
Aye.
and chair votes aye as well. So the motion carries unanimously 3-0. So welcome back as clerk, Maria.
Thank you. Thank you very much.
Okay, now that we've dispensed with the annual reorganization of the board, we'll get back to our stated agenda in order. Approval of minutes. We have 3 sets of meeting minutes before us tonight from May 20th, 2020, special meeting minutes. The following day, May 21st, 2020, our normal monthly meeting minutes. And then June 3rd, 2020, special meeting minutes. I believe you also had reviewed those, Maria. Wasn't quite clear on that, but I think we have before us is what I had edited. So I'm not sure if anyone had a chance to read them, or if you did, if you had any questions or comments or suggested edits.
I have neither questions, comments, or edits. Vice
Okay.
Chair Robert Serrano.
Mr. Rue?
I was only at the 2020, and I have no comments or changes to that.
Okay. So we'll take that one separate. So, and Maria, any comments or edits from you?
No, I read your edits as well, and they look good to me.
Okay. So we'll handle the May 20th separate. We'll do that first so Charlie can vote in that. So someone like make a motion to approve the minutes of May 20th, 2020 as submitted.
I will make a motion to approve the minutes for May 20th.
Okay. Who'd like to second that motion?
I can second that.
Okay. So Charlie seconded it. So motion's been put forth and second to approve the minutes for the May 20th, 2020 special meeting. All those in favor signify by stating aye. We'll take a roll call vote again. So Mr. Rulis,
Aye.
Mr. Scarano,
I think I'll abstain.
okay, and Mr. Rue.
Aye.
Okay, chair votes aye as well, so the motion carries unanimous 3-0 with Mr. Scarano abstaining. And then we'll take the other two together. We have the May 21st, 2020 minutes and the June 3rd, 2020 special meeting minutes. So I can make a motion to approve both of those as submitted.
I will make a motion to approve the minutes from May 21st, 2020 and June 3rd, 2020.
Okay, and who'd like to second that motion?
I have to abstain, Mr. Chairman. I wasn't at the meeting.
Hello.
I think Tony is chiming in.
Yeah, I just was able to get in. I'm just finishing work up right now, but I wanted to get in.
Okay,
Why don't we repeat the motion, Mr. Chairman, so that Tony can hear.
So Tony
Likewise, thank
Bichetti arrives at 6:10?
Yep.
6:10.
okay, we've just approved the minutes for the May 20th special meeting. We're just now having a motion to approve the minutes for the May 21st, 2020 monthly meeting and the June 3rd, 2020 special meeting.
Fine, that's great.
So Maria had made a motion to approve those, and we're just waiting for someone to second the motion.
I'll second it. I read him. That's fine.
Okay, so Tony seconded. So motion's been put forth and second to approve the minutes from the May 21st, 2020 meeting and the June 3rd, 2020 special meeting. All those in favor signify by stating aye. We'll take a roll call. So Mr. Rulis,
Aye.
Aye.
Mr. Scarano,
Abstain.
okay, Mr. Rue,
I think I have to abstain. I wasn't present at the 21st, Ray.
okay, that's fine. And Dr. Bichetti?
Aye.
Okay, the chair votes aye as well, so the motion carries unanimously 3-0 with Mr. Scarano and Mr. Rue abstaining as they were not in attendance. Okay. Good, well, that takes care of new business. We had nothing on for old business. So I guess we'll move on to director reports.
Well, as far as COVID-19 and response and moving into the reopening, as you know, we're in phase 2, part 1, which hopefully tomorrow the governor will announce phase 2, part 2, which will then open up the rest of the services, personal services, come Monday. And then we are hopeful that phase 3 will come soon and not sooner rather than later. The numbers locally and and in the state have been very good. So for fun, I just wanted to tell you the last 7 days. Let's see if I went backward so yesterday we had new cases, 1, day before 1, day before on the 16th 0, 15th 2, 14th 0, 13th 1, 12th 2, and 11th 0. So in 7 days, 7 cases. So wonderful. We wanted to remind you, as I was speaking with the chairman earlier today, as things open up, we do still want to maintain the minimum responsibilities that we all have as far as maintaining our distances, wearing masks where are appropriate and where have been deemed required by the governor for a period of time to try and keep this curve down. Doing a great job. And what's going to happen, obviously, is people are going to start traveling. If you're going to a place of higher numbers, be aware of that, be cognizant. When you come back, you may want to quarantine if you came from a high risk place, say like Florida, right? So we just want to remind everyone, and we have gotten lots of questions from business owners again, we're not pre-approving. Everyone is approving their own plans. They're posting their own attestations that they understand what they need to do. But we do still get questions and we give them, as much guidance as possible. We have had some complaints, not overwhelming. We've been able to handle those, and most of them have just ended with a verbal warning. We haven't gone beyond the written warning at all for anyone. So that's good. Most of the time, business owners not really sure. They're not really paying attention. They're just excited to get open, and they're not realizing that they have an obligation to post their attestation form, which basically says they understand the basic things they're supposed to do: education of their employees, wearing masks, and providing sanitizer. They're it's very basic, the attestation form. So, so if any businesses have any questions, feel free again to call Steve Sadwick about opening. You've probably seen the tents around. So anyone who's gone through the process with departments, have gotten approval from the town manager, and some with the alcohol with the selectmen. So I don't know if anyone's experienced that. I haven't actually done a parking lot meal yet, but maybe soon. We'll see. The new numbers are probably going to be up on the web, if not today, tomorrow. So, as far as how we've been doing them with with community versus the Tewksbury Hospital versus other things. But the state dashboard is still available. Anyone has questions, go to the mass.gov or ma.gov for that. Any questions about the current updates on COVID-19?
I have none. Thank you, Susan. That was very encouraging news. Bob Scarano, Vice Chair.
Okay, well, thank you. We're all working. As you know, we're all at the town hall. We hope the doors will be open soon. We are still waiting for some physical changes to provide protection for employees from, just keeping separation. I don't want to say protection, separation from employees and customers and things. So once those are installed, I'm sure we'll be moving to open, but we are all working. We are all there. So we're essential, as the town manager would say.
So
Which is a
Susan,
good thing.
two things I'd like to add. One, and I think I've shared both of these as we've been talking,
Mhm.
and maybe we can look at doing this as a board, maybe at our next meeting, but a lot of us are puzzled and scratching our heads about what's being allowed to be reopened and the timing of everything. And I think from my having spoke with most people on the board, and folks, please chime in if you disagree, but I think we're all sort of chagrined at the fact that it seems to be politicians at the state level that are driving the decisions about what reopens and what's classified as a phase 2A versus a phase 2B. And it's really hard for anyone to understand or much less enforce these without having any science behind the rationale and who's able to open up when and how with
Mhm.
what requirements. And I think the other part that surprised me, where I do work at a school, and everyone that's associated with schools is waiting with bated breath for the Department of Education to finally release whatever they deem to be will be the requirements of school reopening. I think I was most surprised to find out that at the state level, the Department of Public Health is not the one that's overseeing these reopening requirements. It's being left up to the respective state departments that have administrative oversight responsibility of the different types of operation. So I'm just concerned that decisions being made at the state level that aren't really being done with scientific backup or justification, but more politics is what appears to be happening. And I think I'll echo the same comment that I've seen everywhere expressed, is that there needs to be much more transparency and openness about what the future plans may hold, because finding out last minute that something's going to open or not open, just in time planning does not work. And I realize that we're all on a new path forward, but geez, the state's got to change their way of doing this. And I don't know if it's worth the board putting together some type of a letter to the governor, just stating our thoughts, but I would like to have members entertain and possibly come up with what we could say to that, both to our elected state representatives and to the governor, about lessons learned and what can we do next time to not have the same outcomes, at least in terms of how it's impacted people and the length, especially hearing the numbers, Susan, tonight of where we are case count wise. But I think the other important thing too is that even though the numbers are coming down the state and locally, and thankfully, I'm also concerned that people don't relax their guard completely and think we're out of it. It's not coming back and we can go back to things as normal, because if we all take that mentality, it could come back this fall and be interspersed with flu symptoms and not really knowing what people have. So I think part of this, we get into this predicament because people had forgotten how to practice good personal hygiene. And now that people are getting back to some of the basics, I'm hoping that people will keep practicing some of these new things, or things that they hadn't done for a while, and continue to do them and make them become more commonplace, in hopes that this will greatly minimize or even eliminate the chance that we have a round two of this. So I'll leave it up to other board members if you agree or disagree, but I think that we're at the point now that I think we have enough varied opinions that we may want to put something in writing that we can officially submit as a board.
I agree with you, Ray. I think that the, phase two, people, businesses thought that they were ready to go. They, rescheduled all of their customers, their clients, and then all of a sudden, last minute, they were told they couldn't, which was really problematic for them because they keep changing the dates and these businesses keep, rescheduling their clients. And I find it to be very confusing and really unfair. I realize that the state, and I agree with you, it's more about politics than it is about science, but, I don't know if they're making these decisions based on other states that reopened and, but I don't quite see it as being the same thing. I don't really believe that that's what they're doing. Some businesses like gyms, for example, I don't see why they should remain closed until at least phase three. I don't think that's appropriate at all. So I definitely think letters need to be written to our state reps and, state our opinion on that. It's just all very unfair. I don't want to see another uptick in the numbers, but it appears that people are still being cautious, or at least those that are concerned, like maybe myself. I'm still very careful about where I'm going and who I see, and I'm still taking precautions just for myself. And I think a lot of people are doing that. We can take personal responsibility. But that's just my 2 cents on the subject. So I agree. I think we should write letters.
Mr. Chairman,
Yes, Mr.
I agree with you 100% regarding your comments earlier. And as I've said before, my protest basically for not attending these emergency meetings was the fact that nobody, in my opinion, was listening to our conversations regarding state representation, and that, in my opinion, or the way this should happen, it should be locally. Charlie Baker keeps on talking about he's hiding behind a veil of public health to place these edicts on people in the Commonwealth. I don't agree with him one bit. I'm very frustrated with it. In my opinion, there should be a bottom-up, not a top-down solution to this issue. Tewksbury and Wilmington, Mr. Robinson, are ready to open. We should be these phases that Mr. Baker has put in place with the numbers we just heard from Susan are ridiculous. And what, a lot of people out here are suffering, and I think it's ridiculous, and I don't think we're getting the right representation in the legislature. Thank you.
Okay. Dr. Shetty or Mr. Scarano, any further comments or?
I have to agree with Mr. Rue that and Maria Zaroulis as well, because I think it's an individual thing that people should be practicing, distancing and proper hand hygiene and everything. But we can't continue to have our community closed down. It's totally absurd. And from my readings, I believe Massachusetts, correct me if I'm wrong, if anyone has other information, but I believe we're like 50th or close to the bottom of all the states opening up. We're waiting to see what everyone else is doing. I'm like, I think every state and every community has its unique characteristics and priorities. And I'm like, I know that I'm taking care of people and we're doing precautions, and I'm watching the communities that I deal with doing proper precautions. So we need to just open up, and I think other businesses as well, the people need to inundate, the governor and the representatives, because the way it looks right now, I honestly don't feel Massachusetts, based on what I'm hearing in some of the cities, they're in any big rush to open up. No one wants to, have reinfection or prolong this, but you can't be idle and stagnant. And I think that's what's happened. I think that's even worse for the economy. So I'm in agreement with Maria and Charlie on this, and I just hope that we can get this moved forward very quickly. Thank you.
Okay, thank you, Tony. And one thing I'll add too is that while there have been reports of states that had stay-at-home orders and that relaxed them pretty quickly, that they're seeing an uptick in cases. But I think when you look at those, specifically Florida is one prime example. This all happened before they hit their peak. And so now they're looking at Florida as potentially the next epicenter. So I really look at, you can't look at other states reopening sooner than we did, now having higher infection rate, because they never went through their peak.
Right.
And I think that's why Massachusetts is where we are now, because we've already experienced our peak. And because we did the strict measures that the governor enacted, kept the peak from being higher or longer in duration. So I think at this point, we can't really look at other states as guidance for what to do or not to do, because I think we in New York are in the positions that we've already experienced and gone through the worst of it, as other states are now realizing maybe they should have done what we did.
Well, Bob Scarano, I'm not sure that we can depend on any information that is provided from state to state by the reporting agencies. It simply is not in a format that is susceptible to comparison for reasoning why we should open or keep closed specific businesses. I think there are numbers represented by Susan that are clearly indicative that this area is safe because the transmission of the disease simply is not occurring. And secondly, as it relates to Florida and these other states, they are hitting their peak of testing. And that testing is going to bring more positives.
Yeah.
Exactly.
So I can't rely on that information because the level of testing is one of the things that is driving the numbers in some of these states. Testing occurred early in some states, it occurs late in others. And the level of testing that is being conducted throughout the states, I think is clearly going to indicate a larger number of positives. And that can't even be relied on as a hotspot because you're not comparing the rate and number of testing. Those numbers simply aren't in the equation. So I'd like to be able to rely on what's being provided, and I'd like to be able to look at why there is some artificial barrier to some businesses opening. But I will say that the barrier to businesses opening did not consider any economic impact whatsoever. And in relation to the numbers that were provided, that economic impact on those businesses should have been part of the equation. Frankly, I am not in favor of delegating the Board of Health Authority to a political agency or a political arm of the Commonwealth or anyone else for that matter.
I'm frozen.
We should be remaining autonomous, and we should have a lot of input on what's happening in our community. And frankly, I'm very disappointed that they did not consider our autonomy or consider our concerns or actually consider our numbers in formulating an opening schedule. Thank you.
May I add one question? One thing I agree, Bob.
Go ahead.
I believe one other thing that should be addressed is even though the numbers there have been some increases in numbers, in not one instance that I'm aware of has the healthcare system been overwhelmed that they can't take these increased numbers to address the situation properly. And as I said, as Bob said too, more testing. So there was a concern in the beginning that our healthcare system would be inundated and overwhelmed. And if anyone has any information to the contrary, I'm glad to hear it. But my knowledge and my understanding of what's been currently going on as of this morning was not one of the healthcare systems have been overwhelmed, even though there's been increased use. And I think that was part of the reason why the lockdown came in the first place. There was a concern that the healthcare system would be totally overwhelmed. So I just wanted to add that to Bob, but I agree with Bob as well, and I think all of us are in unison. But anyway, thank you. Sorry to interrupt.
Oh, no.
Well, I would just clarify one thing for Tony. There are hospital systems that certainly are stressed. There are areas that are seeing significant numbers of treatments at healthcare facilities. But again, I think the overwhelming nature of the pandemic did not see and did not produce the kind of numbers that were predicted at the beginning. And to be honest with you, we relied on specific studies that were undertaken from overseas and from people that proved to be less than worthy of having their information considered in making such a bold move that we shut down our complete economy. To be honest with you, looking back at those studies, looking back at those individuals that were touting what was going to happen, most of it, and I will say most of it, proved to be unworthy of immediate consideration and was probably based more on a panic situation rather than a reasoned, thoughtful approach. And I guess just the nature of the panic, and that's what it was. You call it pandemic. It was more panic than pandemic, and the panic itself is what drove the decision makers, our policy makers and decision makers, to do what it was that they did. And now they're backing out of it slowly. I can understand that, but that did not change the fact that most of the information that they relied on was not reliable in the first instance, although it took quite a bit of time to determine that, and I don't think it was delayed. The elderly were at risk, yet the first thing the government does is close the daycare center.
Yeah.
I just don't see it. I thought it was contrived that, when the most vulnerable part of our society, the elderly, is determined right off the bat to be the vulnerable part of this disease, yet the immediacy was to close schools and kindergartens. That was completely contrary to the information that they had immediately as this progressed through Europe and to our country and to the West Coast. And frankly, I think that the decision to close the economy was based on faulty information. I still feel the same way. And I think the opening is based on the same type of information, and it's contrived.
Absolutely, Bob. Absolutely.
Mr. Chairman,
Mr.
my question now is, if they're expecting another wave of this in, the fall or the winter, what are they? Do they expect that they're just going to shut everything down again? It doesn't seem like that would make any sense if this does come back, later in the year.
It'll happen.
Go
I
ahead.
don't think they'll close it down. I don't think they'll close it down.
No, I would think they wouldn't try to do that again. It would be disastrous.
Yeah, I don't think people know what to believe anymore from the sources that are supposed to be knowledgeable. So I think common sense may rule this time, whereas fear ruled last time.
Yeah.
Yeah.
Well, I
if
wouldn't
you enough,
I wouldn't be again in favor of delegating the autonomy of the health department to a decision that seems to be unrelated to the information that we have at hand regarding health. It was related to some other agenda, but it certainly wasn't related to health. And I would have a very difficult time delegating my authority as a health board member to some other agency to control the spread of this disease by shutting down the economy and not taking the local conditions into consideration, and then making sure that someone was conversing with the governor that the local situation in a particular area needs to be looked at. It wasn't done in any fashion. 351 cities and towns, one policy did not work.
Mr. Chairman,
yes, Mr.
I agree with everything everybody is saying. And to Ms. Zaroulis' point, I'm at a point of frustration here, Maria, that I don't know why we're in phase 2, step 1.4, and we're going to head to step 2.2. This whole thing, I don't know if it's a matter of, pride or something, but things have changed here, and I don't see the state or the governor changing along with the information that we've been receiving on this thing. And as far as them shutting anything down, again, I mean, things come in series and in seasons, as they always do. We still don't have a cure for the common cold yet, and for Charlie Baker to stand up there and say that we're not going anywhere until we have a cure for this or a vaccine, in my opinion, is ridiculous. Thank you.
Yeah, you're right.
Yeah, so I guess to answer your question, it's at this point, it's really hard to know whom to believe anymore because the studies everything's being rushed, so nothing's being properly vetted.
Mhm.
Whether it's vaccine studies, antibody test studies, even the whole, is this airborne transmission? Is it droplet? How long does the virus stay alive on surfaces?
Mhm.
Do we need to wear masks or not? So there have been so many flip-flops with no science, proven science behind things that people are really doubting at this point everything they're getting for information. So I think, again, as I was saying before, I think all we can really do is just keep practicing the good hygiene habits that we had forgotten about that we've now had to implement again, and just keep that going to the fall. And hopefully it doesn't mean masks, but at least hand washing, if nothing else, and be more aware of what you're touching.
Yeah.
So
It goes back to the basics, Chairman Barry, that good hand washing, good hygiene, things that, like I said in the past, our mothers taught us when we were small. They go a long way protecting oneself and others. And I think that if nothing else comes from this, I think more people have an increased awareness and just personal responsibility for the simple basics discussed.
Yep, I fully agree. So with that, and I guess, Susan, anything else you had? I know we were aiming to have a short meeting tonight. I wanted to at least have this open discussion, so I thank you all for your participation. Before we wrap up tonight's meeting, is there anything else, Susan, you need to update us on?
I can update you on Tripoli pretty quickly, and then put the rest off to July. I was going to show you some slides, so we can do that. I will send you the slides. I was partook in a seminar from Dr. Catherine Brown, who is with the state epidemiologist and public health veterinarian. The state has worked very hard at trying to identify, since our bad Tripoli year, to identify how we can do better in 2020, and a lot has to do with communication with the towns. When the risk levels, giving more science into that. There's some very interesting science that, over the last decade, they actually have the data that shows, after mid-September, there may still be some mosquitoes, but there literally was no, no human infection, and very low from September to October. So you might have, become a high or a red, in September. And normally it would be, that would be it for the rest of the year. Everything would be closed and dusk to dawn and everything. But now there's going to be really more look at that maybe it can come down depending on the weather, depending on, previous information. So hopefully, this year will be a little bit better. They'll be using, the Health Homeland Security Network system to let us know every week when they do the testing, if we get positives. Shannon's my backup this year. They wanted to have 2 people they can get a hold of 24/7. So if we ever have positives in EEE, we expect it to be, I didn't start with this, we expect it to still be high this year. EEE, generally virus does a 3-year cycle. So last year was the first year that it has been high. And there is no other state except for Florida that had, a high year like we have. So we're not usually compared with Florida. So it's a little weird. But they are working very hard on it. And I know it sounds weird to think of EEE and mosquitoes right now, but public health, has been sidetracked with this other, I don't want to say it, this problem that we've been having that I hope we learn from it, because frankly, public health, when it first came out, if 1 million people were going to die, we were on it, right? We were on it and we all participated and we all did what we had to do. And when the numbers changed, I had hoped there'd be quicker change. So if in a perfect world I had what I could, if I could say, I would say, Governor, not just part 2 this Friday, you should announce part 3, phase 3 should be opening faster. I mean, this is just, it's not right. And we are doing what we have to do because that is our job. But it's very, very frustrating. And I can tell you the phone calls that I'm on, the public health people who have been in this business for 30 years are very, very frustrated with the state, and then the state, DPH that being, and then those people are frustrated as well. It hasn't been a good ride, and I'm hoping that how we respond going forward. Uh-oh, I think I froze. Sorry.
No, you're fine.
Yeah, I think we need to keep this conversation moving forward, because I am concerned, obviously, if it comes back. So we want to get public health, the people on the ground, the boards of health, to be much more involved rather than 17 people that, I don't know, that he chose to move forward. But seriously, at the beginning, we did what had to be done. And I agreed with what was going on. But now it's a very difficult time for all of us to help people through this, because it's out of our control. I wish it was more in my control. So we're doing what we have to do to try and support our local businesses and still protect our citizens. So thank you for all the things you said, and I will definitely support any letter that you would like to put together, and I will make sure that either we circulate it to all the boards of health, or we send it directly to the governor, lieutenant governor, whatever it is you want to do. But nothing is smooth in the world of public health, but we do need to learn from it, and we need to move forward as quickly as possible, I think, right now. And I thank everybody for doing the good job that they've been doing. And I thank my town manager and fire and police. They've all been so supportive. So thank you, everybody. That went from Tripoli right back to the other virus. Sorry about that. It was a weird segue. I'm frustrated, as you are.
Let
And
it out.
there's a lot of time
Right.
wasted in frustration. A lot of time wasted. So we have a lot to do. It's not just this. We got a lot to do. Thank you, everyone.
I think Susan's point should be well taken, that while COVID is important, it can't distract from everything else that we do on a yearly basis to protect the public health, and this Tripoli and clearing up mosquitoes in general, spraying, making sure that there's no standing water. These are all things I think Susan is alluding to, is that you can't be distracted from our general, and I mean general, protection of the public health. And it is June. We've had a dry June. We don't have the wet like we had last year. But that doesn't mean that we don't have to conduct the due diligence necessary to get back on track with our regular process and our regular protection of the public health, even though we've been overwhelmed by COVID.
Yeah.
Thanks, Susan.
You're welcome. Thank you, everybody.
Thank you. Thank you, Susan, and the town manager and all this staff. Thank you.
So I'm good. Thanks for tonight.
Okay. So, Mr. Rue, I think it's your turn.
Mr. Chairman, I'd like to make a motion that we close tonight's meeting. And thank you for everybody tolerating me over these last 3 months.
I'll second that motion and the toleration.
We tolerate you only because you were reelected.
Oh, congratulations, Charlie.
Congratulations, Mr. Rue.
Congratulations.
So, motion's been put forth and seconded to adjourn tonight's meeting. All those in favor will signify by saying aye, but we'll take it as a roll call vote. So, Ms. Arulis,
Aye.
Mr. Scarano,
Aye.
Dr. Machete,
Aye.
Mr. Rue,
Aye.
I should say Mr. Reelected Rue, and chair votes aye as well. So, motion's unanimous. So, it is 6:48 p.m. So, good night, Tewksbury.
Thank you, everyone.
Aye.
Thank you
Good
all.
night.
Good night.